Hello, my name is Shannon Hoskovac, and I'm going to be sharing the results of my systematic review on iodine and mental health in interstitial cystitis or IC patients. I'm a registered nurse. A little background on the origin of this study. I have interstitial cystitis myself, and I was able to eliminate my pain flashes by addressing my mental health and taking daily iodine supplements. I have been without pain flashes for about over 2 years now. I discovered iodine by accident. I got a CT scan with contrast while having a pain flash, and it took away my pain. Shortly after, I started researching iodine and starting this research, and I finished my research about 2 years later. Interstitial cystitis patients struggle with a lot of things other than their own condition. In one study, an alarming 23% of IC patients reported suicidal ideation compared to 6% in the control group. As a result, these patients have a high rate of psychiatric visits and emergency room visits, and also experience other comorbidities as well, seen here on the screen. I utilized the National Institutes of Health and Medline full text to find my articles. Search criteria and keywords are here for you on this slide. I had to extend my search to articles published in the last 25 years because there's been a lot of, um, well, only a few studies on iodine and mental health in relation to IC. I used 25 studies, 14 of which were published in the last 5 years, from when I conducted the study last year. The smallest sample size was one woman in a case study, and the largest was close to 28,000. I used a broad range of different types of studies, including traditional treatments, alternative treatments, studies on iodine, triggers, angiogenesis, stress, and mental health in relation to the body and/or IC patients. Traditional treatments included were amitriptyline, physical therapy, intravesical injections of platelet-rich plasma, endoscopic ablation, and intravesical injections of botulism toxin A. 5 out of 6 of these studies concluded that most patients in their respective studies had an unsatisfactory outcome, adverse event, unpleasant side effects, or eventual redevelopment of symptoms. Although patients reported decreased severity in symptoms after endoscopic ablation, patients also reported that symptoms were not completely gone. Most patients experienced a bad outcome after treatment with botulism toxin A, including adverse events such as UTIs, dysuria, straining to void, and hematuria. It took researchers 4 injections of platelet-rich plasma to reach close to an 80% success rate, although functional protein and cytokine levels were not improved. Although limited, the research on alternative treatments showed more positive results than the research on traditional treatments. One case study showed that using guided imagery 3 times a week could eliminate lower urinary tract symptoms. A larger study of almost 2,000 participants showed positive outcomes in their IC after using things like meditation, heater cold therapy, and stress management. A study on ginseng found common disease target protein seen in the condition by network pharmacology, which comes into play later with the articles that I found, the other articles I found. These proteins lead to inflammation and angiogenesis commonly seen in the condition. Stress is a top common trigger for pain flashes, and it's self-reported in almost 60% of women in a study on pain flash triggers, but mental illness is not included in this number. Multiple studies pointed to psychological stress, increasing inflammation through mast cells and increasing CRHR1, expressed in the submucosa in IC patients. A study on rats reinforced this principle when psychological stress caused symptoms seen in IC patients, such as angiogenesis, compromised permeability of the mucosa, and thinning of the cell layers. A study on depression in ICU patients found that depression was present in 43.6% of women with current depression before the onset of the condition, which could be higher than the data shows due to women with undiagnosed depression. Another study found lactic acid was increased in the brain in untreated severe depression, which could increase lactic acid in the bladder due to altered permeability and angiogenesis there, possibly impacting the gag layer. A study analyzing iodine trends in the United States found urinary iodine concentrations in young women has been declining in recent years compared to 2001 to 2004, and that most women were borderline iodine sufficient from 2009 to 2012 when this study was conducted. Two studies found iodine is effective in expediting wound healing as well as decreasing pain scores. And one of these studies found decreased inflammatory protein markers with the application of iodine on pressure ulcers, also seen in IC. If iodine levels are lower in recent years, especially in young women, with increasingly higher rates of depression and anxiety, the iodine status of young women could dip down below sufficient to mildly deficient, as it's a natural anti-inflammatory, fighting off inflammation from stress, mental illness, and natural functions like menstrual cycles and even pregnancy without showing changes in thyroid function. Psychological stress, as seen in a condition like depression, anxiety, or bipolar depressive disorder, could trigger a cascade of events that may be worsened by a lack of iodine in the body. And here's a little chart that shows the connection of all of the protein markers that's seen in my research. Ultimately, clinical studies should be done to investigate iodine supplementation in IC patients, and screening for depression and high stress should be prioritized in all healthcare environments to spot and prevent the worsening of IC. Thank you so much, and thank you for watching.